Well, one of the terrible tragedies that took place was that we locked our economy down, shut it down. It was a big mistake, and now the World Health Organization has said no way should you have a lockdown. You get more danger with lockdown than you do with trying to treat this properly. And the thing that's need to be done is to isolate the at-risk groups and not lock down your entire society. But let's talk now to medical correspondent Laurie Johnson to tell us about these developments. Laurie, talk about this monoclonal antibody thing that the president was given. What is all that, and what about these vaccines?
Well, Pat, when I spoke with the National Institutes of Health Director, Dr. Francis Collins, he told me out of the hundreds of treatments that are in development and have already been developed, the most exciting are the monoclonal or polyclonal antibodies. And these aren't available to the general public yet, but hopefully they will be soon. We know the president took one on a compassionate use basis, the one made by Regeneron, that has been only given to a couple hundred people. But these monoclonal or polyclonal antibodies actually inhibit the virus from penetrating the cells. They actually neutralize the virus. They're made from antibodies in people who have already survived the coronavirus. They're made in a lab. They're concentrated and synthesized, and they actually prevent people from getting the virus in some cases. So sort of as a preventative, as an immunity in lieu of a vaccine. We know they have to be given very early in the disease. And we know that the polyclonal antibody the president was given was the first drug he was given. He was also given remdesivir, the antiviral, and dexamethasone, the steroid. These two drugs are available to the general public. So we've really come a great long way as far as treatments are concerned since this virus hit us about 6 months ago, which is why health officials say we're seeing a decrease in deaths.
You know, some people say, well, what's better than all this? And somebody says, well, a mask is the best thing. Is that the way it is?
Well, certainly health officials are saying that we need to attack this virus in a multi-pronged way. So, yes, as you mentioned before, people who are at greatest risk should probably stay home. But the rest of us can still venture out into society. We can work and spend money and keep the economy going, provided we take precautions like wear a mask and social distance and wash our hands. So there are, as far as the mask, those health officials say they definitely work and people should be wearing them in addition to the other precautions.
All right, now they're working on a vaccine, but they've had a couple of bad results, so they really slowed it down because they don't want any vaccine to kill anybody. I know that in the polio vaccine that somebody the mother of a friend of mine was given that vaccine and wound up with polio, which is crippling and later led to her death. So the vaccine companies are being very cautious. Could you tell us more about that?
They are. In a rare show of unity, the vaccine companies, 9 of them, issued a joint statement saying we are not going to ask for approval from the FDA until these vaccines that we're developing have met our extremely stringent safety standards, regardless of any political pressure. And regarding the Johnson & Johnson vaccine trial that was put on hold, there are 60,000 people in that vaccine trial, and one of them had some sort of a health problem, and so they put the brakes just temporarily on the vaccine trial just to see what's going on with this person, and it might not have anything to do with the vaccine.
But any feeling about how soon they'll have one? I know they're not rushing, and that's a good thing, because but there was one in Oxford that was going along, and they held that up. What about the others?
Well, it looks like Pfizer is in the lead, and the Pfizer CEO did say last month that it looks likely that they'll have their results one way or the other by the end of October.
So that's before the election. The president would like to see that. Laurie, thank you so much. Your insights are tremendous. We